pranams at the lotus feet of my beloved Swami. Respected dignitaries, my dear brothers and sisters, thank you for giving me an opportunity to speak to you all. Mine is a different story. I have come from an institution which was established by Bhagwan Sri Sathya Sai Baba. After he left the mortal coil, his own student, his own disciple, started walking in his footsteps, and he came to our village and started the mission. From 2011 onwards, he has established 36 educational institutions, 15 hospitals. The uniqueness of this institution and hospitals are everything is totally free of cost. He has established 4 super specialty hospitals exclusively for pediatric cardiac surgeries, 1 teaching hospital which is running the medical college now, 5 mother and child hospitals, and 5 hospitals outside India where there also the healthcare is given totally free of cost. It is not only free of cost, the healthcare is provided in a corporate manner. Our medical education is in rural, of the rural and the far rural. And it is totally, the medical education is totally free of cost. And we shall nurture the students the ability and nobility and stability in each of the students. The most important thing about that, these students, after their graduation, they will go to the rural area and serve the most unprivileged people in this world. Our mission is to give the medical education and the health care of the highest standards that will be imparted and implemented, especially to the underdeserved and vulnerable section of the society. These graduate professionals will participate with a principle that love all, serve all. Our prayer is always Sarve Santu Niramaya, as Sir just told that. The principle that is, let all be healthy. We, in our institution, we work on it earnestly. Medical care provided to all with no discrimination for any reason, financial or any other barriers. We are taking care of their health care. The idea of Vasudhaiva Kutumbakam, that is the whole world is one family, is practiced in true sense in our institution. That is free universal health care that is given to everyone without any charge. But everyone is involved in this program of health care for the welfare of all. Our master always tells us, this medical model should untie the triangulating knots that binds the healthcare services with financial obligations. And we need to change the way of the way healthcare is taught and learned and given and received. My dear brothers and sisters, since last 10 years, we have conducted more than 29,000 free cardiac surgeries. And very important is, even the patient did not have to pay or do the out-of-pocket expenses also. I want to draw your attention, what is the difference between the free medical college and the commercial medical college. I will take a 1 minute on that. You know that in a commercial medical college or a free private medical college, there will be a high medical education fees. When there is high medical education is there, definitely that candidate is going to be put on financial debt. Naturally, after graduating, he will have the commercial approach to the patient care. He considers the profession as the return on investment. Naturally, his direction goes where he can earn more, that is in the urban areas. The end result will be, there will be a huge gap between the healthcare between the urban and the rural areas. If we give the free education, medical education, what happens? We are giving them free medical education with a world-class standards, and we also add to them the moral value, that is value-based education to the students. This will create him to give the gratitude to the society. And there will be an expression of gratitude to the society for getting the free education. And he will develop a compassionate approach to the patients. And he will be ready to serve anywhere in the world, especially even in the rural areas. And this is our aim. We want to bridge the gap between the healthcare system in the rural and the urban areas. My dear brothers and sisters, I will give an example of how our institution has worked. Last year, we have treated more than 3.5 lakh outpatients. Daily, we are treating more than 1,400 patients on an average. We have treated 15,500 as in inpatients. Daily we treat 280 to 290 as inpatients. Every year last year we have treated, we have done 8,500 surgeries. Daily we are doing 25 to 30 surgeries, and we have conducted more than 200,000 deliveries. Every day there will be 8 to 10 deliveries in our hospital. To avoid the extra inflow of the outpatient, as discussed in the morning, we have already started a new scheme called Sai Swasthya program, where we have the satellite centers, outpatient centers in the different areas away from our hospital, nearly 20-30 kilometers away from the hospital, and we will treat them by telemedicine. All patients, especially who are coming for the minor reasons, and also non-complicated diabetic patients, will be treated at that center. So that two important things will happen. Patients' traveling expenses will be saved, and the patient's daily earning is saved. Otherwise, he would have lost one day earning. That's how we have started this. Two important things I want to tell and close. We are always arguing with tripartite, what we call agreement, that is Sarkar, Samaj and Samstha. That should work together. Sarkar should help us in doing the policy matters, and we should utilize their government insurance schemes, whereas Samaj, like NGOs like Lions, Rotary and CSR, the corporates, they should come and help us in this movement. And the organization like us, who are doing total work in selflessly and sincerely, they should be allowed to do the work to the society. When we three come together, we can do the work. That's what happened in our institution. You know that health system is like a pyramid. The topmost is the richest people. They can get treatment anywhere. The middle layer is the middle class people. As they They can also contribute something by the insurance scheme and their little bit savings, but we need to support them because of the, especially when the case comes like malignancies and cardiac problems, and the lower strata is a huge this one, and where we have to support them. I request the government, the NGOs, and also the corporate CSR programs to join their hands with us, and where we can do wonderful work. This is the example. If we have a selfless motive and sincere attitude, this healthcare program can be achieved, and it can be reached to the corner of the society. Thank you very much.